Hi, everyone. Welcome to the National Hematology Oral Examination this year. Thank you for joining us. My name is Eric Tseng. I'm a benign hematologist who works at St. Michael's Hospital, and I'm one of the co-leads for this year's National OSCE.
Hi, everyone. My name is Laura Habib. I'm a hematologist oncologist at St. Mary's Hospital in Montreal, and I'm the other co-lead for the oral OSCE.
So here you are. It's been a year into COVID, and you're doing an oral exam. This exam is purely formative. It's just for your learning, and this isn't going to go on any final evaluations. This is just for you to get a sense of where you're at. We know that some of you may not have studied at all for your exam. Many of you are just starting the second year of your hematology residency, and keep in mind the exam is purposely meant to be difficult to drive your learning. And so we encourage you just to try your best, relax, and hopefully this will be helpful in terms of preparing you for both your hematology practice in clinic, but also for your actual exam as well.
So a comment about the format of this exam. Usually the Royal College examination includes an oral OSCE. And as you know, as with last year, this year there is no oral component, but we still feel that this portion of the National Heme Retreat will be valuable for you, both in your preparation for this year's examination and also for those in the future who will likely pass through an oral OSCE component at some point in time. So typically in the past with the Royal College, the format consisted of 60 minutes of preparation time in which you are given the 10 stems that you will later face in the stations. And you have that time to familiarize yourself with the stems and make a plan. And following that, you then pass through the 10 stations or the 10 OSCEs. The usual format has been 2 OSCEs per station. You have 10 minutes per OSCE, so a total of 20 minutes per station with one examiner to pass through the 2 cases. It's going to be slightly different with our National Heme Retreat. You're going to be given 45 minutes to prepare the 8 stems for the 8 stations you will later pass through. Each site may vary in how they're going to organize things, but you will either have 10 minutes per OSCE or station or 20 minutes to pass through 2 OSCEs with one examiner. This may be done virtually, it may be done in person, and that's going to be at the discretion of your various sites depending on what your resources are. But ultimately, your program directors and admin staff where you are will provide more of the logistical details around how they're going to organize the day for you.
So as Laura mentioned, each station 10 minutes. The way the stations are designed is, as you know, the initial stem has a series of 2 or 3 questions to address with your examiner. With 2 minutes left in the 10-minute station, your examiner has been instructed to ask you a follow-up question that will take you a bit more into the content of the case, and then you can answer that and then move on to the next station.
So a couple of tips going forward. Please focus on answering the actual question that is being placed before you. The hematology exam does differ slightly from the general internal medicine OSCE component that many of you might have just come out of recently or in prior years. Essentially, we want you to approach it as a consultant and to really focus on taking a very directed history and physical. Don't forget to ask the pertinent questions. And if you are going to be counseling on a treatment or suggesting a treatment, don't forget to counsel on side effects and take a proper consent.
So that's about it in terms of what you need to know about the exam. There's a couple things we wanted to say. Firstly, we just wanted to give thanks to those who have helped to prepare the exam this year. We have a number of authors and editors and translators. The benign hematology cases were written by Christine Matusiak from Toronto, James Kennedy from Toronto, Miriam Kimpton from Ottawa, and Salma Shivji from Calgary. So thank you to them for their efforts.
And for the malignant OSCEs, a very big thank you to Jaja Liu, who's one of our authors from Toronto, Anna Nikonova from Montreal, Shireen Sirhan from Montreal, Ryan Kedby as well from Montreal. And also we'd like to offer a very special thank you to Rosemary Tremblay-Lemay, who is a heme pathologist at UHN in Toronto, who offered a great deal of support in reviewing all the OSCEs.
Also a thank you to our translators. Alexandra Goulot, Caroline Elbaz, and there was a third one, Laura.
Yes, I'll just correct that. I'm sorry. Caroline Elbaz, Catherine Grolot, and Alexandre Vazinet. So those are the three who really helped us translate the stems for the French sites. We hope that you'll find that useful.
Perfect. And finally, a final thank you to the program directors and administrators throughout the country. As Laura mentioned, they've adapted the exam to your own local context and obviously a lot of logistical support. So thank you to everyone. And we really hope that this is a good learning opportunity for you all. We welcome your feedback on the content of the OSCE, and we hope to see you all in person soon. Thank you.
Thank you all.